Good afternoon again, everyone. Thank you for joining us for our webinar, Get Started with URAC's Health Utilization Management Accreditation. We know some of you are current URAC clients. We know some of you are new to URAC. So just to set this out right away, we are gearing this. So if you are a current URAC client, this may be a little bit of repeat for you, but we hope you'll share some of what you've learned along the way with the people who are new here. We've been doing webinars for so long at this point that you all are pros at it. But if you have any technical issues during the webinar, please message Nick Davis. Need my slide back. If you can use the chat box, as you'll see, we use the chat box for questions and to introduce yourself. We don't have a Q&A box intentionally because we just want everything to flow through the chat. We have a bunch of team members supporting in the chat today, and they'll say hi and be chiming in resources that you will see. Here's our agenda for today. I'm here to do the welcome, make you feel good, get to know who we all are a little bit. My slides are advancing without my knowing them. Wonder if there's timing on them. Anyway, we're going to have Dr. Griffin come on and talk to you about URAC. Then Monica Gordy, who's one of our clinical accreditation reviewers, is going to come on and talk about our different options when applying for accreditation through our health utilization management program. We're going to talk about the client experience. We actually have two clients here from two different utilization management organizations. We're here going to talk about it. And then we're going to end out talking about the URAC accreditation process for those who are new. So, like I said, there's me, there's Dr. Griffin, he'll come on board, Monica Gordy, and all of her teaching elements. This is her teaching at our in-person event for clients last year. That's Lee Hamilton, who happened to have been standing in front of a URAC sign when I saw this. She's with Alliant Health Solutions. Nasiba Manan is with Health Plans Incorporated, another accredited client, and Kurt Acker is our Director of Business Development.
Hi, everybody. I'm sitting in DC today. It is sunny. They always pick on me about giving the weather report when I do a webinar. But just thrilled to have you all here. I'm the president and CEO at URAC, so I'm the person who signs your certificates when you get accredited. So that's the fun I get to do. A little bit about URAC for those of you who don't know. Over 35 years of experience as an accreditor. We believe in accreditation. We believe in independent accreditation. We think that having an accreditor who isn't trying to sell you consulting hours, isn't trying to sell you some sort of weird and wacky thing to go along with their accreditation is the best accreditation, because we see ourselves like auditors. You want them to be independent. You want them to be trusted. We know that excellence looks different in every organization. If you're a little pharmacy on a corner with 6 employees, that's very different than if you're a massive multi-state chain spread across 3 continents or anything like that. But our standards can apply no matter what size of your organization is and what community you serve. We're very proud of the work that we do. We also know that partnerships are the key to our work. So we have advisory committees. We have an independent board made up of healthcare experts. We have everything from doctors to nurses, to insurance companies, to payers, all these different groups around the table, and everybody gets to come together and focus on what's best for patients and what's best for communities. So we're very proud of that. Next slide, please. So when we talk about accreditation, very often we say that regulation sets a bar for safety. You can be licensed. When I was practicing physician, I was a licensed physician, but I was also board certified by family practice. And that's because I did extra training, more than the bare minimum. And people who are URAC accredited are doing more than the bare minimum. And we think that it sets a higher bar for quality. And we believe that the quality that we look for is the quality that we would entrust our family members to. So that's why we care so deeply about what we do. We value people. Next slide, please. So I'm going to turn it over. I believe I need to hand it over to Monica to give an insight as to what's going on here and talk about the process. But I just really want to thank you guys all for being here. We appreciate you taking time out of your day to learn more. And we're meant to be a resource for you as you go forward. So Monica, I will turn it over to you and disappear from the screen.
Thank you so much, Sean. So good afternoon, everybody. I am Monica Gordy, and as Lisa stated, I'm one of URAC's clinical accreditation reviewers. I am a registered nurse, and I have over 10 years in the utilization management arena. So URAC is really proud to offer a full suite of recognition programs for the utilization management organizations. And more notably, we do have modules to accommodate your program, whether you perform all functions of the UN process or just part of it. So we have four modular programs for health utilization management. We have pre-review screening, initial clinical review, clinical decision support, and clinical review criteria modules. And we also have, for those organizations who perform functions under each of these modules and perform appeals, we have a comprehensive accreditation. So I'll spend the next few minutes telling you a little more about each of these programs, and I'll give you a little information about what URAC looks for when you're applying for one or all of these modular accreditations. So let's review our UN programs to help you determine which one might be best for you. Thank you, Lisa. Sorry, 1 second, please. So as you can see here, we do take a modular approach to our accreditation. And as you can see across the top, we have the first four boxes are the modules that we talked about. And then we do have that comprehensive, those are subsets of the comprehensive accreditation. And then on your left, the left column, you can see the focus areas that kind of help you determine which module or combination of modules that would be most appropriate for your organization. So if you perform all of those functions under the focus areas and you conduct appeal reviews, then you might be more appropriate for the comprehensive accreditation. And then if you just see here on that second row there where we talk about the utilization management program, that focus area applies to all of the modules, and that focuses on the organization's program structure, as well as your oversight or monitoring of your program's performance. Additionally, you'll see towards the bottom that two of the modules plus the comprehensive accreditation has some of the notifications focus area. And then if, again, like I said, if you perform appeals, we have an appeals focus area that applies to those who are applying for the comprehensive accreditation. So let's go ahead and take a closer look at each of these modules. We can go to the next screen, please, Lisa. So for the pre-review screening module, this module is for organizations who conduct the initial screening for utilization management. Those are the organizations that accept incoming, prospective, concurrent, or retrospective review requests, and they're able to provide timely reviews of those service requests. This module does not involve evaluation or interpretation of clinical information. And in this module, what URAC will look for is we'll look to see that you have fully trained administrative personnel and making sure that they have UN requirements and procedures that they're able to follow. We'll take a look at job descriptions and we'll look at your initial screening process. Next one, please. So the next module, it would be the initial clinical review module. And under this module, these are for organizations who use qualified licensed clinical professionals, such as LPNs or RNs, who are able to issue prior authorization certifications, or if they're not able to offer those certifications, they move those cases to a peer reviewer for further review. So this module would be for organizations who have, like I said, that team of first level reviewers that are using evidence-based clinical criteria to help them determine if they're able to issue that certification decision, or help them to decide if that case needs to go on for a clinical peer review. So again, non-certifications are not rendered under this module. And so for this module, URAC will verify that your reviewers are properly credentialed. We're making sure that you're using approved evidence-based clinical criteria. We'll make sure that your organization is not issuing non-certifications based on that initial clinical review. And we verify that you're issuing those certifications or timely certification notifications. So you'll definitely want to show us how you verify credentials and then what happens during that review process. So for this next module, it's the clinical decision support module. And here, this is for organizations that conduct the peer review process. If you're not able to render a certification under that initial clinical review module. So for the clinical decision support, organizations are going to use qualified um, and licensed clinical providers to issue that determination, and they're making that determination based on a review for medical necessity. Like I said, when that certification is not issued on that initial clinical review. So if your organization excels at facilitating the peer review process, then this might be the right module for you. And under this module, URAC will look at your clinical decision, your peer review process. We want to make sure that clinical peer reviewers, what happens when certification was not issued? What does that process look like when it goes to the clinical reviewer? We're also making sure that you are using licensed and credentialed providers, and then we'll look at documentation that outlines your process for conducting that peer review. So under this last module, we have the clinical review criteria. And under this module, this is for organizations who develop and evaluate the criteria for making those decisions for the clinical criteria for making the utilization management decisions. And if your organization does this work, then you likely excel at reviewing evidence-based literature and keeping your criteria up to date with the newest trends in healthcare. And so when your organization or organizations who apply for this module, they should be prepared to show URAC how the organization reviews and updates and maintains that clinical review criteria, and showing us that you have qualified clinicians who are making this, who's helping develop this criteria or evaluate the criteria. So under this module, URAC will look at your process for how you're developing and maintaining that clinical criteria, who's actually making involved in what kind of credentials and experience do they have. We're making sure that you're using appropriate staff or committees who will be involved also in approval of that criteria.
Monica, I hopped on
Yeah.
camera. I want to give you a break, but I also want to ask you a question.
Okay.
And I just want to ask you, like, Monica's one of our clinical accreditation reviewers. She's out in the field
Mhm.
all the time, and she sees a lot of good happening. Can you give an example from maybe one or two of these different modules where you like see something, you're like, that was really good. You don't tell us what organization,
Right.
but just something obviously, but something you've seen recently where you're like, hey, I learned from that, because part of our process is educational, and we send our
Mhm.
URAC accreditation reviewers out on the road to both teach and learn. And we're constantly learning from our clients, and we're sharing what we've learned from other clients and saying, hey, have you thought about this, or have you thought about that? So is there something you could point to from maybe one or two of these different modules that you've seen recently that you're just like, hey, I love this?
Sure. So some of the organizations we see have, for their policies, for example, or when they're outlining their processes, it's really clear and very distinct who under the certain areas of for example, if they do a comprehensive accreditation, when they're transitioning from the peer review process under that administrative staff to the initial clinical review portion of the process. It's very clear there when they lay out very clearly how that process works, and spelling out who's doing that part of the process, and then helping to show us really clearly how you distinguish that from then when it moves on to your peer review process. So just the policies or the procedures that are really clear, very succinct, and just kind of to the point, we find tend to kind of have the, I guess, best results on the desktop review. And then when they're able to demonstrate that very clearly under the validation review. Also organizations under, for example, the when we're talking about making sure and verifying that they have qualified and credentialed or clinicians or reviewers. The organizations who really have a process in place that's reviewing for the primary source verification of licensure on a more regular basis, where we require, maybe every 36 months at a minimum. But the ones who are able to do that on more of a annual basis tend to have the better outcomes through our accreditation process. Does that answer or
It
meet some of what
does.
you're looking
It
for?
does. And is there anything you want to say about, like, so they've met our accreditation, which Kurt's going to talk about the accreditation process in a
Hmm.
minute, but what does that translate to in their day-to-day work? Like, what this has
Well,
good, and Lee is going to touch on this later about the patient impact here, but
mhm.
this has good stuff for patients too and for other providers.
Right. Well, and for the day-to-day work, we certainly want to make sure that you have people who have the qualifications and the appropriate experience, who's making these review determinations. They should be able to pull on their experience and their knowledge. So, so when they're writing either the clinical review criteria or when they're making those determinations, they're pulling on that knowledge, and that helps to bring the best outcome for the patient ultimately.
Awesome. Thank you. Bonnie, I am going to hold your question. Monica has one more slide. And like I said, we like to
Okay.
have questions throughout here. Tina, I'm going to ask one of our team members to get back to you in the chat question about the modules being part of the full accreditation.
Mhm.
And Sean, I'm going to give Monica the floor for another minute. And then before Lee comes on, I'm going to ask you to pop in and discuss AI here. Because I think that's an interesting topic. And I think Sean could talk about it for a couple of days too. So Monica, this is
Okay.
your last slide
Yes,
here.
right. So as you can see, like I just talked about, we have the individual modules that an organization, based on the functions that you perform in your organization, you may qualify or be appropriate for one or a combination of those individual modules. However, if you perform the functions under each of those modules and you perform appeal reviews, then you certainly would be appropriate for that comprehensive module. So we just like to really help you determine which one would be best for you.
Um, and I
And
think
then,
this answers oh, sorry.
nope,
Mm,
go ahead.
No, I think this answers Tina had a question about are all the modules part of the full accreditation? Or is each module its own accreditation? And I think that's a
Right.
combo answer.
Right. So each module can be its own accreditation. So if you do the clinical review criteria module, for example, then you would have the HUM accreditation on, for the clinical review criteria module. If you do, like I said, if you do a couple of these, the pre-review screening and initial clinical review, but you don't have peer reviewers for the clinical decision support, then those two modules would be more appropriate for your organization, and you can be accredited under both of those modules. Um, but then if you perform, like I said, all of the functions under all of those modules and the appeals, then that's when you would be more appropriate for that full comprehensive module.
Thank you, Monica. I hope that answers your question. Sean, will you come back on here? Yeah, it does.
I'm
Um,
back.
s- so Sean, I think you've seen in the chat, you're usually really good about this. And Monica may be able to tell you, but I think the answer may be a little too soon. But Bonnie's asking us this great question, and it's going to come up more and more.
Mhm.
Can you discuss challenges organizations have had in the application review process when addressing how they use AI in supporting effective clinical review and decision support?
Well, I'm going to tell you, I'm not the right person to answer part of this question because I don't have the experience as to of how the reviewers are running into AI in its usage. I will talk to you a little bit about how, right now, artificial intelligence usage in healthcare is a very, very hot topic. Everything is trying to be sold with AI these days. And I will say that our general stance in regards to AI, we're creating the first AI healthcare accreditation. It's going to come out later this year. We have an advisory committee, a great advisory committee to work on those standards. But what we say is that the standards that we have talk, if you're using any tool, whether it be AI, whether it be algorithms, whether it be a Ouija board, The clinician still bears the responsibility. People still have the responsibility to take the inputs from any tools that they are using to provide proper oversight and to exercise their review. So nothing is the machine told me to do it, and that's why we do it. There needs to be explanations. You need to follow the policies, the procedures that you have. You should have policies about what AI can do, what it can't do, how you inform patients, and make sure that you're following your own policies so that when we bump your policies up against your practices, that they match. But AI is an emerging area, and we're proud to be working on the first program in this area. Lisa, did I answer part of that at least?
I think you answered the general part of this. And Monica, I realize you may or may not be even seeing this yet in the accreditation reviews. I know we have it as an optional standard in there, but I also realize that
Mhm.
we may not have hit the point in reviews that we're starting to see this.
Yeah, actually, I think I just saw my first one. Um, and so, yeah, we haven't really seen too much of that when we're going through our accreditation process because it is just so new. So I guess the biggest thing is just making sure that organizations are keeping up with all of the regulations or the obligations that are out there, um, because that's what we're looking for when we're doing that review of the AI and ML selection criteria.
Thank you. Monica, you were great. I always love presenting with you. And now we're going to bring Lee on board. And Lee Hamilton is with Alliant Health Solutions, and she's here to actually talk about how URAC helps improve business and the patient experience as well. With that, I'm going to go off camera.
Hey, everybody. Good afternoon. I am coming to you from Atlanta, Georgia. Um, we have my company is Alliant Health Solutions. We are a contractor of the state of Georgia. So we do all of the utilization review and work with some of the different waiver programs, basically making sure that we are reviewing clinical documentation and looking for the benefit of medical necessity. And also, while doing that, as many of you know, if you do work, we can find things like fraud, abuse, and learn about new disease processes and such. So this is just an overview about Alliant. The thing that I want to share with you the most is that we have been accredited since 1997. We believe in URAC. We believe that it not only helps us as leaders, but also our reviewers who are reading about things they've never heard of. Medicine is moving faster than we are. So to try and keep up with all of that, as well as coding, is quite the task. We are a smaller company, so you may know that many government agencies do contract out their work. So I am the deputy director of the prior authorization department for the state of Georgia, and we serve the fee-for-service Medicaid client population. So as far as, so I'm going to talk about two things. The first one is going to be how it helps how URAC enhances our organization. And then I'm also going to talk about how it can actually help our members. So the cool thing about URAC is that there are many different accreditations, right? So we go and attend the URAC Connect conference each year, which is priceless because we get to meet lots of people that do the same thing, lots of people that do different things, but maybe do pieces of what we do, and the engagement and making connections with these folks, sharing ideas is an awesome place to be, because I don't know about you, but I don't have like a circle of friends that does work day to day. Most of my nurse friends, because I am a nurse by trade, work in the hospital. So with URAC, we just got reaccredited in March. So we completed a mid-cycle prior to that, and then our full accreditation with a different auditor this year. And having, if any of you are interested in accreditation and are not accredited, the amount of support that the URAC leaders and educators, your field reps provide. First of all, it's the quickest, promptest replies ever. They also help not only to walk through the standard with you, but use examples, like day-to-day examples, to really make sure that you understand it, because it's important when you read these standards that you truly understand what they mean. So Alliant, we are data-driven, systems-driven, and just like Dr. Griffin was talking, AI is hot, and we are dipping our toes in that. So that's been exciting. We also do a lot of, so obviously with URAC, we are making sure that we're doing a standardization of review for all of our facilities, doctors' offices. And on the other side of that, we're making sure that we are doing the quality management piece and process improvement. So we also have a high trust certification, and we work with Medicare. But how it just thinking, don't think real hardly, just like off the top of your head, how does URAC help us? And it helps in a big way. I think something that it has this year, because every mid-cycle or every reaccreditation, there's usually one or two things that really that get pointed out. And it's not even necessarily that we did anything wrong. It just may be like, there's a better way to do this. And so talking again to those people that we've engaged with, that we've met, that we go to connect with each year, we have people that we can lean on and share information. So how it helps our organization is that we can better keep up with the pace of healthcare. We have this wonderful book of standards that really are a great guideline. Like if you want to do a thorough, a very fair, standardized review, you've got your rule book right there. And that's super helpful to know that we are treating every provider and every member as a result fairly. So the Department of Community Health here in Georgia they have great trust in us, because we really do follow these standards and make sure that we are setting an example for other review organizations. The other thing that sticks out in my mind is that came from our accreditation is continuous process improvement. I probably right now, as the deputy director, am overseeing at least 10 process improvement projects, and that only enhances whether it's streamlining a process or decreasing provider burden as far as submitting prior approvals, pre-certifications. It's always helpful. And it also keeps the mind constantly thinking, like, what else could I do better? And it's contagious, because then other people hear maybe an idea that I have, and they can add to it, make it even better. So I do pride us on great process improvement. And again, that's part of URAC. You must show that you are constantly doing some sort of process improvement to ensure that you are making healthcare better. The other thing I was going to say is this new age of technology and being technologically driven, it's important that you have some sort of guidelines to go by. AI is awesome, especially when you know how to use it or have a particular program that you're using. It's even better when you're following the best practice with it, and making sure that what it was built to do is doing what it should do. So as a result, we oftentimes automate a lot of our decisions, whether it's a denial immediately for some sort of technical reason or an approval. And so when up for a contract, when the department is looking for a reviewer, we have great turnaround times. We can get our patients care quickly. The other thing I was going to say is the organization of policy and procedure. Now, I can't even imagine if you are a private payer or if you come from a private payer, because you are huge. We're fortunate enough that we are a small enough piece of Medicaid that we can make sure that policies and procedures are always updated, that they are annually reviewed, that the leaders truly know what their processes are, so that if they do have an employee come to them and ask a question about a review process and such, they will have it. And they also give, we work together on updating things like our internal policy manuals. So I would say getting really organized with our policy and procedure, making sure it's updated, and also using some of those URAC approved organizations that can help you do credentialing, check physician credentialing, nurses, that sort of thing, PTs, dental hygienists. And then even better, the way that it helps our members. What I think of, one of the biggest things, because we are not really customer facing, member facing, we work with the providers, and that is that peer-to-peer request. So when we have a case where a provider has submitted for, let's say, a knee replace, and it gets denied by a peer consultant, one of our anonymous 200 plus MDs across Georgia that practice, and they do review work for us. They're all anonymous. We have over 70 specialists, and we've got some really cool specialties that have come in great use, especially lately. But because the standard requires that there is a 1 business day turnaround time, that's going to decrease. That's going to, again, if it gets approved, better access to care for the patient, decrease in provider burden because they're not having to submit all of these appeals and make all of these calls. And so just overall a decrease in resources needed for that process. And because of URAC, we were able to completely overhaul our peer-to-peer process and make it seamless. So we've integrated into our system.
And Lee, I think a lot of organizations see this process improve. And I think you are one of probably 20 people on this webinar who could say the same thing. I hope other accredited organizations, if you're hearing this, say, you are welcome to chime in the chat box. Yes, we've seen this as well, or we've improved X. We love hearing those stories as well. And Lee, I think the trust that you guys have gotten from the Georgia Department of Community Health is huge, especially when governmental, public, and community health is being a challenge. If they're trusting you,
absolutely,
that's huge. Lee, I want to make sure that we give it over to Nasiba with enough time. Nasiba is going to talk a little bit more about working with a reviewer.
I could say a million more things, but it's been
but we
nothing
will,
amazing
you can
for us.
talk to Lee if you come to URAC Connect, our annual event for our clients. She is happy to chat about that. Nasiba, the floor is yours. Thank you. And I'll pull up your slide just so you can have it up on the screen so people can see a little bit about Health Plans Incorporated while you talk.
Thank you, Lisa. Hi everyone, I'm Nasiba Mannan. I'm the manager of quality and accreditation at Health Plans Inc. Our parent company is Harvard Pilgrim, and we are based out of New England, Boston, Massachusetts. And we are a self-funded healthcare. So you can pretty much see on the slide, I'm not going to go into details, more details. We started our first accreditation with URAC during the pandemic. In 2020, we started our process, and then we successfully became accredited in 2021. And it was daunting process because we were first in doing an accreditation for our organization. And we were familiarizing ourselves with the standards and the requirements. And at that time, URAC standards were not this version. It was the older version. There were many more standards and many more requirements. But once we went through the audit and the accreditation process, I think it elevated us as an organization with our policies and processes. We already had, for example, a complaints policy or an appeals policy, but what helped us was to fine tune them in order to meet the requirement, get them organized, get them more available, accessible, and more fast-tuned it. So those were pretty helpful. But a funny story, once we first completed our accreditation, we were really happy. We felt that we did really well. And then we found out that URAC came up with all new standards for our next reaccreditation. So we were crushed. We thought, oh my God, we have to learn this thing all over again. We have to do new processes and policies. But this is where I commend URAC, because we found out the process got even better and it was easier, and it was more user-friendly. And with the new standards, we found ourselves to do the processes more faster and more easier. So now we worked with two reviewers. The first one was Diane, and the second one, Monica, is here. So we worked with Monica, and I have to tell you, she is very professional. She was very patient with us because these were new standards for us again. She was very accommodating. We had millions of questions for her. She made herself accessible. Sometimes I know she was in an audit and she would respond in the middle of the night or very early in the morning. But it was a very pleasant experience for us working with both our URAC reviewers. And as you go through the accreditation process, my recommendations would be to get very organized. I think that is one of the things we learned, that getting organized helps with the accreditation process. And also build a relationship with your reviewer. Then whatever questions you have, it's easy to communicate. And all our URAC reviewers that we worked with were very friendly and accommodating to all our requests and questions. So those are pretty much my recommendation. I don't want to take more time.
Nasiba, I always say, and Sean says this too, our strength is in our reviewers. Sean, will you come back for like one quick second before Kirk takes the screen? I think you and I do this where we say it a lot together. Of one of the great things about our reviewers is that no matter who you get, they are all trained the same way. They're all, we do our own checks and balances of them. We do inter-rater reliability tests. What am I missing there that you want to chime into?
Well, I mean, I think that there are differences in our reviewers, and we try and train them to all be the same, but they're all experienced. They all bring different experiences to the table, so they're all there to help you. I said one of the differences that I really appreciate about URAC is that we're not there trying to catch you doing wrong. We're trying to be there to help you do right, because we're only going to be there a little bit of time, and you're going to be providing care all the time. And so it's not a gotcha. It's really about a we got you, and we're going to help you.
Awesome. Nasiba, thank you. And thanks, Sean. I'm going to bring Kurt. Excellent. Perfect timing.
All right, good day, all. So I'm going to just go through a couple of slides here. What you're looking at is sort of a summary of what we just discussed. The key to HUM with URAC now is to be clear about what modules that your organization performs, because when you pursue an application, you're going to be held to the standards for those particular modules. So the four that you see there: pre-review screening, initial clinical review, clinical decision support, and clinical review criteria make up the four modules. When you add in appeals, you have comprehensive. So that would be module 5. You can choose 1, 2, 3, 4, or all 5 in the case of comprehensive. Again, comprehensive including appeals. You want to be careful with that one. Just make sure you do appeals, and then you should be good there. So just a reminder, any single piece of this is an accreditation, so you can choose a single module here. And as you increase the amount of modules, the workload becomes a little bit more, but you're choosing the module appropriate for your organization. Can you go to the next slide, please? So the accreditation process, once an organization signs an application agreement to move forward, is relatively straightforward. Not much has changed over the years with our process, except for the time. We've done a really nice job at URAC under Sean's guidance, Dr. Griffin's guidance, to decrease the amount of time on our end and shorten the cycle to get from start to finish. The first step in the process is very heavy on the client. That's the upload of the application. That's the first phase. And you're building your application at that point. You're entering your policies and procedures in the portal, and you're getting your application as strong as you can up to that point, and you're submitting it. Typically, this is a 60-day process. Organizations do it typically in less than 60 days. Once you're done with that, you submit the application, you move into the desktop review. This is a stage that is a back and forth between the client and the reviewer at URAC. The URAC reviewer will take the application that you uploaded, they'll do a review of it, and they'll begin to provide the feedback to your organization that is going to help build your application. So they'll do that first review on your application. They'll send it back to you with comments and requests for further information, and then you'll work on it again. And then you'll resubmit it once again. And if needed, the URAC reviewer will do it a second time. So this is a back and forth 2 times, building your application, strengthening it, because once complete, you'll now move into the third phase, which is the validation review. And as the name says, this is sort of the stage where a reviewer will either come on site or do the review virtually, depending on what is appropriate. And as the name states, they're validating that what is in the application is actually in play at the organization. This is a key stage because your reviewer will be very frank with you here. They'll be very clear with you. You will have been doing your application for several months now, and you'll know your reviewers quite well. This is the last stage in preparation for phase 4, which is the committee review. The committee will come together. Your application will be redacted of all identifying information, and it will be assessed based on the merits and the quality of the application itself, not on who your organization is or who your competitive organization is. And that's when the decision will be made. Assuming all goes well, a full accreditation is extended to your organization. The ongoing monitoring continues for the next 3-year cycle. All accreditations take place, go through a 3-year accreditation cycle. At the end of the 3rd year, or sometime during the 3rd year, you'll be contacted by your URAC client relations manager, and that individual will walk you through the reaccreditation process as you prepare and pursue the next accreditation phase. Next slide, please. So there were a couple of questions in the chat about application resources. I mentioned the client relations manager. Once you sign an agreement to begin the application process, URAC assigns a client relations manager to your organization. This individual will be with you through the entire application process and beyond. For those of you that have been with URAC for many years, you may have the same client relations manager, or you likely do have the same client relations manager for many, many years. These individuals stay with your organization. They're your first and point of contact to guide you and facilitate not just the application, but the reaccreditation questions, answers. They're really your key point of contact in the relationship with URAC. The accreditation program guide is provided to you once you become an applicant. The client information hub is a loaded resource, a destination for you to have answers, to facilitate questions, and really dig in and get, and all of the data that we provide there, all of the library resources are there. The standards inquiry interpretation portal was asked about on the webinar chat, and this is simply where you can post questions regarding standards and have a reviewer review that question and then provide answers back to you. Webinars, both for new prospective applicants as well as current clients of URAC. We have webinars that are solely for existing clients that are very helpful and well attended. And then AccrediNet is the system that we're using. And of course, the reviewers were mentioned in the chat. The reviewers are really your prime relationship with URAC, and they stay very close with our applicants as well. So with that, I will pass it off, hand it
Kurt,
off.
I'm going to pull up our closing poll. I'm just going to ask you, I'm not going to share the results of this, but I'm going to ask you if people want more information about URAC or about our accreditation programs. I do want to say a word about the Client Information Hub. That's a project that's under my purview. It is full of tons of information. There are tip sheets in there for going through accreditation. There are videos. We actually, if you are a current client, we just released a whole new set of videos on the foundational focus areas, which are covered under our health utilization management program. So you'll see those there. Totally worth a check out. If you don't have access to the Client Information Hub, please check in with your client relations manager. The other big thing, and Lee mentioned this, I'm going to end the poll. I'm going to give the poll another minute. Is URAC Connect. URAC Connect is our annual gathering for clients. The picture you saw of Monica at the start of the webinar was her teaching at URAC Connect. It is taking place this October 7th through October 9th. We take place in Washington, D.C. So you have access to a bunch of URAC staff members. Lee and Nasiba are both multi-time attenders, I think. And Tina, a couple of other people in this room are in here. So big fan of it. We're going to open registration for it next week. You can, and Mary, you asked, where can we obtain access to the Health Utilization Management version 8.2 guide? If you go onto the Client Information Hub, there is a tab and you can request the current guide for your program. And I'm looking else here. Dolly Marie, I see your question. I'm going to have one of our team members get back to you about streamlining and timelines. Timelines are a little bit different depending on organizations and time, and yours will be specific and your dates will be specific to your organization. But we will have somebody get back to you about that. Oh, Sean, why don't you come on for me and ask this question that everybody's been wanting to have answered? What happens to DEI under the new law? And I know we have DEI written into one of our focus areas. I'm going to let you take this one. And then I'm going to thank everybody. After you're done, I'll thank everybody for attending.
So DEI is meaning different things in different parts of the country these days. And there are some states that still have state laws requiring DEI. And there are some states who, if you say it, they throw water at you or something like that. So I would just say that right now we're continuing to watch what's going on. About a mile away from where I sit in my office is the White House, and we will respond accordingly. We say that you're to be compliant with all state and federal laws, no matter where you're working. And so that's what you should do. Our programs support the care for the community, and we think that you should be representative and look like the community that you work with. And so we think that's a good thing. We have never said that you have to have 47 of one thing and 27 of another or anything like that in our standards, but we have said that best practices include inclusion and looking at gaps in equity. We have a health equity accreditation. We think diversity is a good thing when dealing with a diverse population. So nothing has changed. We still look for you to follow your state and federal laws where you operate, and we do too.
Thank you. Aw, Tina's loving that. It is so good to see both familiar and new faces here. Thank you all for spending the time with us. Thank you to Monica and Kurt and Sean, and thank you to Lee and Nasiba for joining us to actually share, like, what is it like to go through? It's always so great to hear from our current clients. And many of you, I hope I will see you on a future webinar or at URAC Connect, a bunch of fans there. So thank you all for chiming in the chat box. If you have any questions, just reach out and we'll be in touch. Thanks so much, everyone. Have a great afternoon.